Hamstring muscles. This is the posterior part of lower limb. Here is the gluteal region. This is posterior part of the thigh. Back of the knee joint, that is popliteal region. Back of leg, Achilles tendon, dorsum of the foot, plantar surface of the foot. Here we can see the bones. This part is ischial tuberosity. It is a part of hip bone. This is thigh bone, femur. In the leg, the medial bone is tibia, lateral bone is fibula. So this part of hip bone has three parts: ilium, ischium and pubis anteriorly, sacrum, coccyx posteriorly. So let's talk about ischium, particularly ischial tuberosity. This roughened area is called ischial tuberosity. So what are the features in the ischial tuberosity? Here this ischial tuberosity is divided by a horizontal ridge into upper quadrangular part and lower triangular part. This upper quadrangular part is further divided by an oblique ridge into superolateral surface and inferomedial surface. This is superolateral. Acetabulum faces laterally, so this is superolateral surface. This lower triangular part is divided by vertical ridge into lateral surface and medial surface. Now what are the muscle attachments? Here this part is divided by horizontal ridge above oblique ridge into superolateral, inferomedial. Here in superolateral surface we can see one muscle. The muscle which takes origin from here is semimembranosus. From inferomedial surface we can see two muscle takes origin. So one muscle is semitendinosus, the other muscle is long head of biceps femoris. This lower triangular part is divided by vertical ridge into lateral and medial part. From the lateral part, ischial part of adductor magnus. This medial part does not give any muscular attachments. So here we can see all the four muscle takes origin from ischial tuberosity. They get inserted into any one of the leg bone, either tibia or fibula. So this is hamstring muscle. To call it a hamstring muscle, it has to follow four criteria. Any muscle is studied under four headings: origin, insertion, nerve supply and action. So what are the four criteria to call it as a hamstring muscle? Origin. All the four muscle has to take origin from ischial tuberosity. Insertion. All the four muscle has to get inserted either into tibia or into fibula. That is either one of the leg bones. Nerve supply. All the four muscles are supplied by the same nerve, that is tibial component of sciatic nerve. Action of the muscle. It causes flexion of knee joint, whereas extension of hip joint. Now coming to first muscle, semimembranosus. The muscle takes origin from ischial tuberosity from superolateral surface. So from superolateral surface of ischial tuberosity, it gets inserted into posterior part of medial condyle of tibia. So this is medial condyle of tibia, lateral condyle of tibia. This is fibula. Here posterior part of medial condyle of tibia. The semimembranosus is attached. The muscle continues as oblique popliteal ligament. So the morphological significance of oblique popliteal ligament is semimembranosus muscle. Next muscle is semitendinosus. The muscle takes origin from ischial tuberosity. Where in the ischial tuberosity? From inferomedial surface. Inferomedial surface two muscle takes origin. One semitendinosus, other one is long head of biceps femoris. So from here the muscle reaches the upper part of medial surface of tibia. So this is tibia. The tibia has medial surface. Medially it extends to form medial malleolus and it has lateral surface. Here anteriorly this is tibial tuberosity. Upper part of this medial surface is subcutaneous throughout. It does not has any muscle attachment, but only in the upper part three muscles are attached: sartorius, gracilis and semitendinosus. Sartorius, that is one muscle from the anterior compartment of thigh, anterior superior iliac spine. Sartorius, medially gracilis, here in the anterior surface of body of pubis. Exactly in this place the gracilis takes origin, which runs in the medial compartment. It goes to the medial surface of upper part of tibia. From the posterior compartment, from ischial tuberosity, semitendinosus. This is semitendinosus. All the three muscles are inserted into this upper part of medial surface of tibia, and these three muscles are called as gyro muscle. The insertion is in the same place, whereas origin is from three different compartments of thigh: anterior compartment, medial compartment, posterior compartment. It is called gyro muscle or parachute muscle. So this semitendinosus is attached to upper part of medial surface of tibia. The next muscle is biceps. Long head of biceps takes origin from ischial tuberosity. So where in the ischial tuberosity? From the inferomedial surface along with semitendinosus. It is inserted into head of the fibula. This is long head of biceps femoris. So the short head does not take origin from ischial tuberosity. So short head of biceps femoris is not a hamstring muscle. This short head takes origin from linea aspera of femur. The muscle gets inserted into head of the fibula. Next muscle is adductor magnus. It takes origin from ischial tuberosity, also from ischiopubic ramus. The part which takes origin from ischial tuberosity is called ischial part of adductor magnus or hamstring part of adductor magnus. The part which takes origin from ischiopubic ramus is called adductor part of adductor magnus. That is non-ischial part of adductor magnus. Here we can see the adductor part of adductor magnus is inserted into linea aspera of femur, whereas the ischial part fibers reaches the adductor tubercle just above the medial condyle of femur. But to satisfy hamstring criteria, the muscle has to insert it into either tibia or fibula. But here the adductor magnus is inserted into adductor tubercle, which is present in the femur. This muscle from adductor tubercle continues as tibial collateral ligament, which takes attachment to tibia. So this adductor magnus is inserted into tibia indirectly through this tibial collateral ligament. So till here is the adductor magnus muscle, which gets inserted into adductor tubercle. From here the muscle starts as medial collateral ligament or tibial collateral ligament and gets inserted into upper part of tibia. Now this satisfies the insertion criteria of hamstring. Now third one, origin is over, insertion is over. Now coming to nerve supply. All the muscles, hamstring muscle, semitendinosus, semimembranosus, long head of biceps femoris, ischial part of adductor magnus. All the muscles are supplied by tibial component of sciatic nerve. So this is sciatic nerve in the posterior compartment of thigh. The nerve divides into tibial nerve and common peroneal nerve in the upper part of popliteal fossa, in the superior angle of popliteal fossa. Above this, the nerve is a single nerve. In thigh, it is a single nerve called sciatic nerve. This nerve has two components, tibial component and common peroneal component. The four hamstrings are supplied by tibial component of sciatic nerve. The short head of biceps, which is not a hamstring muscle, is supplied by common peroneal component of sciatic nerve. So all the hamstring muscles are supplied by tibial component of sciatic nerve. Now the last criteria is action of hamstring muscle. All the muscle causes flexion of knee joint and extension of hip joint. Now what are the clinical features? Applied anatomy of hamstring muscle. So the clinical anatomy is tear or spasm of hamstring muscle, or pull of a hamstring muscle, or total avulsion in the hamstrings. So here we can see tear of the muscle. Here we can see total avulsion of a muscle. So there is total disconnection between the origin. All the four hamstring has ruptured from the ischial tuberosity. So the type of strains are divided into three grades. Grade 1 is pull of a muscle, that is muscle spasm. Grade 2 is tear in the muscle. Grade 3 is complete avulsion of muscle from the bone. So what are the causes? Overload of muscle because of excess exercise, excessive running, playing games like soccer. So here what happens? The muscle gets pulled or torn because of improper warming up or excess overload. How do we treat hamstring pull? So the method is called RICE method. Rest, ice application, compression with bandage, elevation of the limb. Here we can see ice application. This is compression. So rest, application of cold pack, compression and elevation. These are the methods to treat the hamstring spasm. Now what is the treatment for hamstring tendon tear? When there is a complete avulsion of muscle from ischial tuberosity, the treatment has to be surgically done. So normally the hamstring muscles are stitched or stapled to the ischial tuberosity. Here we can see they're trying to stitch the hamstring muscle to the ischial tuberosity. The muscles are stitched or stapled to ischial tuberosity. Here we can see the sutures. So the hamstring muscles are being sutured to the ischial tuberosity. Now how to stretch hamstring muscles? There are certain ways. One in sitting posture. Here to stretch the hamstring muscle. This is standing posture to stretch the hamstring muscle. And this is called chair method. Here the hamstrings are being stretched. The hamstrings can be tightened through progressive exercise. Earlier exercise are cycling, squats to strengthen the hamstrings. Later we can move on to extensions, jumps and push. The last stage of strengthening the hamstring muscles are curls, hill running and single leg deadlift. This has to be done progressively and not suddenly. Thank you.